What if I told you that some of the choices you make every day, how you sit, how you move, and even the shoes you wear can influence whether or not you develop varicose veins? Varicose veins are more than just a cosmetic issue. Trust me, I'm a board certified cardiovascular surgeon. I've been taking care of varicose veins for 20 years. For many people, they cause leg pain, swelling, night cramps, and over time, they can even lead to serious complications like life-threatening blood clots or even open wounds that we call venous leg skin ulcers. The good news is, while you can't change your genetics, there are lifestyle habits that do make a difference. Genetics are at the core of this. It runs in families, and it's definitely a major link, but there are things that we can do. So in this episode, I'm going to walk you through the most effective lifestyle changes to lower your risk of varicose veins, improve circulation, and protect your long-term vein health. We'll cover movement, weight, diet, leg positioning, and even what kinds of shoes and clothing that might help. So if you've noticed spider veins, early varicose veins, advanced varicose veins, or you just want to take some steps now to keep your veins healthy, this episode will give you practical, science-based strategies you can start using today. So let's get into it. Number one, stay active and move regularly. We talk about that in a lot of my videos. One of the most powerful ways to prevent varicose veins is also one of the simplest. Keep moving. Circulation is key. Here's why. Your leg muscles, especially the calf muscles, act like a pump. We call it the calf muscle pump. Every time you walk, you flex your ankles, you climb stairs, those muscles contract and squeeze the veins, pushing blood upward toward the heart. This counteracts gravity, which is always trying to pull blood downward into the legs, especially when the little one-way valves aren't working. When you sit or stand for long periods of time, that pump is not activated. Blood begins to pool even more in the veins, and the pressure rises, and over time, the stretching of the vein walls and the valves leads to swelling in the soft tissues. This is how varicose veins begin, the stretching and expanding and extension of the vein walls under pressure. The encouraging part is that you don't need to do extreme exercise to protect your veins. Simple, consistent activity makes a real difference. As I say in many of my videos, walking is one of the very best choices. Cycling and swimming are also excellent because they engage leg muscles while being easy on the joints. For people who sit at a desk all day, which is many of us, I recommend standing up and walking around at least every 30 to 60 minutes. This gets the blood flowing. Even small things like flexing your calves under the desk, doing ankle circles or toe-ups, and marching in place while you're on the phone will definitely help keep blood moving. Next is do everything you can to maintain a healthy weight. This is another key lifestyle change that can lower your risk of varicose veins. And maintaining a healthy body weight is good for your circulation overall. It's good for your heart, it's good for your arteries, it's good for your blood pressure, and it's definitely good for your veins. And here's why that matters. Excess body weight places additional pressure on your leg veins. Think of it this way. Your veins are already working against gravity to return blood from your feet and ankles and from your legs back up toward the heart. This is a big ask. When you add extra weight, it's like turning up the pressure inside a garden hose. The walls stretch, the valves weaken, the blood begins to pool. Over time, that makes varicose veins more likely to develop, and existing ones are likely to get worse. Studies have shown that people who are overweight or obese have a significantly higher risk of chronic venous insufficiency, which is the medical term for poor blood return from the legs due to faulty valves. This isn't just cosmetic. It's a real circulation problem that can lead to swelling, skin changes, blood clots, infection, cellulitis, leg ulcers, bleeding, and many other complications that, trust me, you don't want. The encouraging part here is that even modest weight loss can help. Losing just 5 to 10 pounds can reduce the strain on your veins. This eases symptoms like heaviness or fatigue in the legs and slows the progression of chronic venous disease. So how do you approach this? Focus on sustainable, healthy habits rather than crash diets. This is a diet rich in fiber, lean proteins, fruits and vegetables, which supports good vascular health and cardiovascular health overall, and also helps with weight control. Fiber is especially important because it prevents constipation, which in itself raises pressure in the leg, in the pelvis, in the abdomen. So this is another great thing to do. Exercise, of course, ties directly into weight management as well. exercise burns calories. The same walking, swimming, or cycling that strengthens your calf muscles also helps regulate weight, giving you a double benefit for your circulation. If you're struggling with weight, know that this isn't about perfection. It's about progress. Every step you take toward a healthier body weight is also a step toward healthier veins. The bottom line, by managing weight through balanced nutrition and regular activity, you reduce one of the biggest risk factors for varicose veins and worsening varicose veins while improving your overall cardiovascular health at the same time. This has been linked also to longevity. If your work requires long hours of standing, like nursing, teaching, or retail, try shifting your weight from one foot to the other or walking a few steps every so often. Even micro breaks reduce venous pressure. This is really important. And here's something many people overlook. Structured exercise helps, but daily movement matters just as much. In other words, walking the dog, taking the stairs, parking farther from the store, which I always do, by the way. These little habits add up over time to a healthier circulation. One of the other things I like to do is walk around, pace the floor while I talk on the phone, because that moves a lot of blood. I get steps in and I improve my circulation and I unload that venous hypertension in my leg veins. The bottom line, movement is medicine for your veins. Every time you engage your leg muscles, you help blood return to the heart and you lower the chance of varicose veins developing. And you also decrease varicose veins that you might have, the chance of them progressing and getting worse. Now let's talk about elevating your leg. This is another simple but powerful lifestyle change to help prevent varicose veins. Leg elevation. When you elevate your legs above the level of your heart, you're essentially giving your veins a break. Gravity, which usually makes blood pool in the lower legs, now works in your favor, helping blood flow back toward the heart more easily. This reduces pressure inside the veins, decreases swelling, and allows the valves to function more efficiently. I want to give you a really important tip about leg elevation. If you're sitting in a chair and you put your legs up on a hammock, those legs are not elevated because you're in an L position. Your heart is up here, your legs are out here. Your heart is still above your feet and ankles. That's not leg elevation. In order to elevate your legs, you need to be lying flat on your back and put something under your feet and ankles, like a wedge pillow or a couch cushion works well. Regular pillows don't work that well because they typically compress and get pushed down, but something that will get your feet and ankles at least 8 inches above your heart. They don't have to be way up in the air like this. That's very uncomfortable and impractical. But 8 inches above your heart, and you're getting that fluid and the venous blood return flowing beautifully back toward the heart. So that's a pro tip right there. Sitting with your feet elevated on the coffee table or a hammock or a hassock is not the appropriate technique. You have to be flat with the feet above the level of the heart. Now, for people who stand a lot and spend a tremendous amount of time on their feet or who notice leg heaviness at the end of the day, this can be especially beneficial. Many patients tell me that just 15 to 20 minutes of leg elevation makes their legs feel lighter, less achy, and less swollen. For me personally, I'm in a very difficult position professionally because I'm a surgeon. So I'm either sitting at my desk doing paperwork, reviewing charts, reviewing studies, etc., or I'm standing in the operating room all day long. I do very long days standing or sitting. So in between cases, I'll either take a walk in the hallway of the office, or if I have a few extra minutes, outside the office, and at times I'll lie flat on my back on the office floor and put my feet up on a chair to help with that venous return. Very, very important. So I'm doing these same things that I'm advising you to do. So how do you do it? We've talked about it. You have to be flat on your back, feet up. Some people even use the wall lying on their back. Now that requires a certain amount of flexibility. It's certainly to put your feet all the way up at 90 degrees, but you can put your feet up against the wall at different angles. Just make sure that it's higher than the heart. Aim for a few short sessions throughout the day, especially if you sit and stand for long periods like I do. You can do 5 minutes at a time. And certainly in the evening when you're lying down on the couch, do this exercise. Get the feet up above the level of the heart. The leg elevation has been shown to slow progression because of the decreased chronic venous hypertension in the legs. Think of this as a supportive measure, one tool among many to improve your vein health. The bottom line, by making a habit of elevating your legs regularly, you can reduce that vein pressure, ease swelling, and give your veins the break and the support that they need from that constant pull of gravity. The next thing I want to suggest for you is to wear compression stockings. This is another proven way to support your veins, and I do it every day here at the office. I wear a good 20 to 30 millimeter mercury graduated compression knee-high compression stocking. This is especially important if you're at higher risk for varicose veins, and compression stockings are specially designed to apply gentle, graduated pressure to the legs. They're tightest at the ankle and gradually loosen as they go up the leg, either to the knee or a thigh-high length. These are both graduated, meaning the pressure is greatest at the bottom, less at the top, and this helps to promote blood flow. That design pushes the blood up toward the heart, counteracting gravity and making it easier for your veins to return blood to the heart, which is essential for your circulation. For many people, compression stockings can reduce symptoms like heaviness, swelling, or aching in the legs. I know they do for me. They're particularly helpful if you have a job that requires long hours of standing, like nursing, teaching, surgery, retail, or if you're sitting for long periods of time, such as during travel. I always wear graduated compression stockings whenever I'm flying or taking a long car ride. There are different types of compression stockings. Some are over-the-counter, available in pharmacies, while others require prescription and can be fitted to your exact leg measurements. The level of compression you need depends on your symptoms and your vein health, and also what you can tolerate. Some patients have limitations because of their weight, because of their flexibility, because of arthritis in their hands. Not everybody can put on a super tight pair of stockings, so that's why you have to work with a professional to assist you to make sure that you can access this form of care. Now, generally for mild discomfort, a lower level of compression may be enough, but for more advanced disease, your doctor may prescribe stronger stockings. One important point is that compression stockings do not cure varicose veins. They're not going to treat the underlying genetic and inflammatory process that's causing those veins and those valves to fail. But what they do is to manage the symptoms and slow progression by improving blood flow and reducing the venous pressure. Think of them as a supportive tool, not a permanent fix, and certainly not a cure. If you're considering compression stockings, consistency is the key. Wearing them during the day, especially when you're most active, will provide the greatest benefit. At night, when you're lying flat, you typically don't need them, although many of my patients find them comfortable to keep on. So there's no problem in keeping them on when you sleep or when you're lying down, but it's not essential. The bottom line here is that compression stockings are one of the simplest, safest, and most effective non-surgical ways to protect your vein health. They won't make varicose veins disappear, but they can help you feel better and keep your circulation moving in the right direction. My next bit of advice: avoid prolonged sitting or standing when possible. One of the biggest everyday contributors that we've already talked about in this video to varicose veins is really something that many of us simply can't avoid: long hours of sitting or standing. And here's why it matters. When you sit for too long, whether at a desk, in a car, or in a plane, your calf muscles stay inactive. Remember, those muscles act as pumps that help push blood back up to the heart. It's like having a little heart in each one of your calves, pushing blood back up into your circulation, back to your cardiovascular system and the right side of the heart. It's an amazing mechanism. But without that pump working, blood begins to pool in the veins, stretching them out under pressure. You know, I have a very dear friend whose mother actually spent so much time sitting, playing on her tablet, playing one of these very common games. I won't mention the name of the video game, but many of us have played it, and I'm sure many of you have played it, and it can be addictive. She literally spent so much time sitting in the chair that the blood pooled in her leg to the extent that she developed a deep vein thrombosis, a DVT, which led to a pulmonary embolism, which wound her up in the hospital and could have killed her. Thank goodness it didn't. But it just shows you the real dangers of prolonged sitting in the venous system. It can lead to blood clot and pulmonary embolism in worst case scenarios. Now, this same process happens with prolonged standing. If you're on your feet for hours without moving, gravity pulls blood downward, and the veins have to work overtime to fight against it. Over time, this can weaken the valves in your veins and make varicose veins more likely to form. So what can you do? If you sit a lot, try to get up and walk around at least once every 30 to 60 minutes. Even short breaks, like walking to get water, standing while talking on a phone call, can make a definite difference. While seated, you can also flex your ankles, point and lift your toes, or do small calf raises under the desk to keep the blood moving. moving. If you stand a lot, shift your weight from one side to the other, from one foot to the other, or gently bend your knees and stand up straight repeatedly. This will really move a lot of blood. You'd be surprised. Or even take a few steps every few minutes to and from your desk. If possible, use a small footstool to alternate resting one foot, which eases strain on your veins, and then switch to the other foot. For both sitting and standing jobs, combining these micro movements with compression stockings can significantly reduce venous pressure. The bottom line, your veins don't like stillness. Movement, even in small doses, keeps blood flowing in the right direction and lowers your risk of developing or worsening varicose veins. You know, having been a specialist in this area for many years, I've thought a lot about this. And when you think about it, you think about animals out in nature, they don't live the way human beings do in modern society. It's very abnormal to stand in one spot and operate, for example, for 6 hours or 8 hours. It's very abnormal to sit upright in a chair and work for 8 hours. These are abnormal behaviors. Typical animals out in nature, they're either on the move because they're chasing something, they're going to get water, they're finding something to eat, they're traveling to a new location, they're being chased by another animal, or they lie down flat and rest. We, unfortunately, typically are not in a profession where we're walking or moving all the time. There's very few people who have that. A mailman might be a good example, a UPS driver or somebody who's delivering packages. There might be other examples of people who are more labor-oriented and doing physical activities where they're on the move quite a bit. But most of us do not get to lay down all day at work. That's a good way to get fired, quite frankly. At least in my office it would be. So it's very unusual behavior to be standing and sitting all the time, which is probably one of the reasons we're the only animal that really develops varicose veins. My friends who are veterinarians tell me they don't see varicose veins in animals. It's very, very rare, and typically because you have hind legs and forelegs and the heart sits in between them, whereas our heart sits directly above our ankles and we're in an upright position, which is also quite abnormal. So you have to make a real effort in your behavior to avoid this modern work environment where we're sitting upright or standing upright all day long. So you have to keep it in mind and make a real effort. The next thing I want to talk to you about is choosing the right shoes and clothing. This is another lifestyle factor that often gets overlooked in vein health, and it's what you wear, both on your feet and on your body. So let's start with shoes. High heels may look stylish, but they're not great for circulation. If you ask a lot of podiatrists, they're probably not great for your feet either, and especially your toes. But here's the deal with varicose veins. When you wear heels, your calf muscle stays shortened. It doesn't contract as effectively. That means the calf muscle pump, which normally helps push blood back up to the heart, isn't really working as well. Over time, this reduced pumping action can contribute to venous pooling and varicose veins. I'm not saying that you should never wear heels, but limiting them to special occasions and choosing lower heels or supportive shoes for everyday use is really a bit better for your veins. Flat shoes that allow your calf muscles to flex naturally are most likely the healthiest choice. Clothing can also play a role. Very tight waistbands, girdles, or skinny jeans can compress the abdomen or upper thighs theoretically, and that makes it harder for blood to flow freely back from the legs toward the heart. Instead, I suggest you choose looser, more comfortable clothing when possible, especially if you're already having vein issues. Now, here's an important distinction. Compression stockings are designed to apply graduated compression in a healthy way, but everyday tight clothing isn't. One supports blood flow, the other restricts it. The bottom line, supportive shoes and non-restrictive clothing may not seem like major health decisions, but they do affect your circulation. By making smarter choices in what you wear, you give your veins the best chance to do their job efficiently and keep blood moving in the right direction. The last set of lifestyle changes we'll talk about has to do with your overall health, because what you eat, what you drink, and do every day affects your veins just as much as your heart and lungs. First, let's talk about diet. A diet high in fiber is one of the simplest but most effective ways to support vein health. Why? Because fiber helps prevent constipation. When you strain in the bathroom, intra-abdominal pressure rises, and that extra pressure gets transmitted down into the leg veins. Over the years, this repeated stress and strain can contribute to varicose veins. Whole grains, fruits, vegetables, and legumes are all excellent sources of natural fiber. Hydration matters too. Staying well hydrated keeps the blood volume and viscosity at healthier levels within your veins, and this makes it easier for the blood to flow or to circulate. Dehydration, on the other hand, can make blood thicker and harder to pump through the weakened veins. It can also lead to blood clots. Now, lifestyle choices like smoking and alcohol also play a role. Smoking damages blood vessels. So does vaping, by the way. And this weakens overall circulation. In addition, excessive alcohol can contribute to vein dilatation and worsen swelling. Cutting back or quitting can have a direct positive impact on your vascular health. Another factor is body positioning during sleep. For pregnant women, for example, sleeping on the left side reduces pressure on the major vein, the inferior vena cava, that carries blood back to the heart, easing circulation in the legs. My father was an obstetrician for 40 years, and he would frequently recommend this technique of sleeping on the left side to his patients, especially as the pregnancy progressed and the uterus enlarged. Let's not forget regular physical activity, not just structured exercise, but an overall active lifestyle. The more you build movement into your daily routines, the stronger your vascular system remains. The bottom line, your veins don't exist in isolation. A balanced diet, hydration, avoiding harmful habits, and smart daily choices all come together to create an environment where your veins can function at their best. The last thing I would mention is dietary supplementation to manage and to help support healthy veins and a healthy vascular system. Micronized purified flavonoid fraction, MPFF, has been studied for over 40 years and has been shown to support the venous system in many ways. It also supports the lymphatic system and the microcirculation. So things like MPFF and horse chestnut, these kinds of dietary supplements have been shown to have a major impact on supporting vein health and circulation health. It's something I would also look at if this is an important area to you in terms of maintaining the best circulatory health that you can. In closing, let's review what we've learned. Varicose veins are incredibly common, but they're not inevitable. While genetics and age certainly play a role, your daily habits can make a real difference in whether these veins develop, how quickly they progress, and how much they affect your quality of life. To recap, here are the key lifestyle changes we've discussed. Stay active and move regularly. Remember, your calf muscles are your body's natural pump to return blood to the heart. Maintain a healthy body weight to reduce unnecessary pressure on your veins. Elevate your legs above the level of your heart to give your circulation a boost, your veins a rest, and to relieve swelling. Use compression stockings when needed to support blood flow, especially if you're on your feet or sitting for long periods, or if you're going to be traveling on an airplane or in a car for long periods of time. Also, avoid prolonged sitting or standing without breaks. Your veins need movement. Choose supportive shoes and avoid overly tight clothing that restricts blood flow. Also, remember to look at dietary supplements like micronized purified flavonoid fraction, horse chestnut, and others to support a healthy venous system and circulation overall. Finally, support your overall vein health with a high fiber diet, good hydration, avoid smoking, and the use of excessive alcohol. These are all simple changes, but when practiced consistently, they can go a long way in protecting your vein health. Now, it's important to remember lifestyle changes help prevent and slow varicose veins, but once veins are significantly damaged, medical treatments may be needed. The good news is modern therapies are safe and effective and minimally invasive, and they can restore both comfort and appearance. If you've noticed bulging veins, persistent leg pain, swelling, or skin changes, don't ignore them. Talk to a vein specialist. Early evaluation and treatment can save you years of discomfort and prevent complications down the road. I'm Dr. John Chuback, board-certified cardiovascular surgeon. Thank you for spending this time with me. If this video was helpful, please share it with somebody you know, and don't forget to subscribe for more practical, evidence-based information on vascular and cardiovascular health. Take care of your veins, and they'll take care of you. Stay tuned for the next video. Thank you.